It's another wonderful evening here in this beautiful city of Calgary. Time check, it's past the hour of 7 o'clock in the evening. And with me is a very special guest from Dynamic Sleep and Respiratory Clinic. And joining me in this segment is Abel Pagaling. First of all, sir, please introduce yourself.
So, my name is Recoco. I'm currently managing the Dynamic Sleep Respiratory Care South Branch, Calgary. So, if we primarily deal with snoring. So,
Snoring. It's very
Snoring.
important
So,
topic.
do you snore?
Yeah, do you snore? Do you snore?
All right. Before we talk about Dynamic Sleep and Respiratory Clinic, first of all, Roy, has this been your career from from the Philippines, or
no, it's actually.
can you share to us your background first?
Yeah, started off in the Philippines as a medical representative for United Laboratories. Then I immigrated here after 11 years working for that company. Then at first I was working as a teller in a bank here in Canada. Then I was referred to Quality Sleep Care to be part of their team. Then eventually I was transferred here to Dynamic Sleep and Respiratory Care.
So this is your newest branch. How many branches do you have so far right now?
This is our first branch, Dynamic Sleep for Dynamic Sleep and Respiratory Care. We are planning to open branches here in Calgary as well, and in Edmonton. We actually have another branch in Edmonton in Sherwood Park, and we're currently going to expand to probably around 4 to 5 branches
All right.
in the near future.
Yeah, so Dynamic Sleep Care or Respiratory Clinic is one of the newest, businesses that we have here in our community, and I guess it's also very important for us to know what is this business all about? What are the services that they offer? Because as we all know, as Filipino Canadians or as a Filipino community, we do have a lot of issues also affecting our community. So before we talk about the specific programs that you offer, what are the things that you want to know or that you want our audience to know about Dynamic Care?
So Dynamic Sleep and Respiratory Care, we primarily deal with sleep apnea. So sleep apnea is a disorder that one of the symptoms is snoring. So if you are snoring, there's a big chance that you might be positive for sleep apnea. So if there's anyone who's snoring, just get a referral from your doctor. Have them write a referral to Dynamic Sleep and Respiratory Care. We do mobile services for free. We also provide lifetime service with the purchase of the CPAP machine. And I believe we're the only clinic who does that for the patients. We also offer in-house financing for a patient who doesn't have insurance and couldn't afford to purchase a machine. Could pay it off in a year's time without interest. So if you know someone or if you yourself snore, you could get a referral from your doctor and send it over to us. And once we receive the referral, we'll get in touch with you and we'll book you up for a sleep study, home sleep study.
Abel, do you snore, by the way?
I
don't want to put you on the spot.
My wife says I snore, but I don't believe her because I've never heard myself snore.
Yes.
But having said that, I think I do snore. And then just a question, what's the age demographic of the patients that usually come into Dynamic?
There's no particular age. Anyone can be affected. It's in fact hereditary. Even newborns can have sleep apnea.
Wow.
So
If you know how to sleep, then possibly you have a snoring problem.
Yep. Especially if one of the parents is positive, then chances are your children could also inherit that. So if you are snoring and if your partner is also snoring, it's best that you have your children checked as well for sleep apnea.
I'm just very curious about about snoring, because to a lot of people, snoring is just a normal thing. If you're sleeping, then chances are you snore. In your experience coming from this kind of business, why do you think it is important to treat snoring?
So yes, snoring itself is a symptom. It's not a snoring percent that we want to correct. But the effects of snoring when you go to sleep. If you go to sleep and you are snoring, your airway usually narrows down, which prevent oxygen to come in. So if your brain is deprived from oxygen, then it wouldn't be able to function well. And we must always consider that the brain is the commander of our body. So it controls all the functionalities of our body. So if it's not getting enough rest, it won't be able to function well. So
it's very important to get a good sleep.
yeah,
Yes.
it is.
I think the mood swings, a lot of the issues and crankiness.
Yes.
I think
Productivity level.
productivity also is impacted by lack of sleep. Do you do a like a open house for people who are curious and or diagnostics for people who think they may have issues with sleep apnea?
Yep, we do. We welcome everyone who wants to know more about sleep apnea. Our clinic is open from Mondays through Saturdays. Monday to Thursday, we're open from 9 a.m. to 5 p.m. And on Fridays, we are open from 9 to 4. And on Saturdays, we are open from 10 to 4. So they're free to come into our clinic to know more about sleep apnea. And we could show them all the different machines that could help them out with sleep apnea.
And is it covered by Alberta Healthcare?
Unfortunately, here it's not yet covered by the provincial insurance. But if you have private insurance, most of the insurance covers them. And we also direct bill. So if you have insurance that is capable of directly billing, then we could cater to that as well.
Do you also provide services to those people who have problems with sleeping, like they cannot sleep well?
Insomnia.
Insomnia, like
Yeah, the
insomnia?
coffee drinkers.
Or this is not the right place to go?
This could be a right place just to rule out other factors because if you have insomnia, those are disorders that are brought about by untreated sleep apnea. So we have to determine first if you are positive for sleep apnea. Then we would treat sleep apnea. Then eventually, if we could treat that, then it could probably treat insomnia as well.
And refer to a specialist
Refer
if
to
needed.
a specialist.
Yeah.
We always refer back the patients to their physician just to discuss more on their results because there might be other factors that we weren't able to see for the patient. So,
Aside from the effects to health, productivity level, and other effects to someone who has problems with snoring, has there been a case? I'm just being, this is just hypothetical. Has there been a case where it actually affected their relationship or it broke their marriage because a partner has a snoring problem?
that is a very good question. Around 10% of people who suffer from sleep apnea have problems with relationship because if you have sleep apnea, then you are deprived from oxygen, then you won't be able to function well. And in terms of sexual relationship, the brain is the main
Stimulant or
stimulant for you would need the brain to function well to be able to stimulate yourself. But if you're not getting enough oxygen, then you won't be able to function well. At the same time, if you're snoring, like for most of the patients that I encounter, they would sleep separately from their partners, which eventually would take a toll in the relationship. So. Yeah.
I know some friends who snore, and it has always become, the talks around our circle. Especially when you're going out of town, you just don't want to be in the same room with this friend of yours who has this problem, right? So I'm just pointing that out, not to kind of put that person down, but for me, it is more than that. It is something that I guess we should pay attention because there's importance to. Why we should treat snoring. It has so many adverse effects to one's health and to a relationship, and as a whole, it just decreases your productivity level, And I'm not talking here as an expert, but this is just what I think are the things that, coming from my personal knowledge and experience, would be some of the things that we should consider in, understanding the effects of snoring and how this can be treated. So, in your perspective, do you think that this is treatable? This is something that people should not be scared, and people should be open-minded to really find ways or discover whether they have a snoring problem or not?
I'm glad you asked that. So there are available therapy for sleep apnea, one of which is the CPAP machine. Most of our insurance covers them, so make use of your benefit, especially if you are positive for sleep apnea. You would really benefit with the CPAP machine. And it occurs more frequently than we know. It occurs to 1 out of 4 agents. So chances are you might be positive if you're sleeping. You are right, like what you mentioned earlier.
And how long is the treatment? How long does it last usually?
Usually, we don't set a certain amount of time for the treatment of sleep apnea. So the purpose of the CPAP machine is to enable the patient to breathe better when they are sleeping. And if they are sleeping well, then they would have a more positive disposition when they wake up. So we usually encourage patients to use that energy to improve their lifestyle, to be more active. And the good thing about sleep apnea, if one of the factors of it is your weight, and if you are more active and if you could shed off more weight, then that would lessen the effects of your sleep apnea. Then probably in the long run, you could get off the CPAP therapy.
So being physically fit and active is also important. It plays a big role in having a good sleep, I guess.
It does.
That's amazing. So with the dynamic sleep and respiratory care, you have specialists in-house. What are some of the credentials that they have to be able to help out?
We have a lot of expert clinicians here. We have RPS GTs, RTs, and we have doctors from back in the Philippines who are practicing here as RPS GTs. We have RTs and physical therapists who practice for sleep apnea.
Lots of experts.
Yes.
That's awesome.
Yeah, so if you guys are tuning in and watching this segment, if you think that you need to discover whether you have a snoring problem or not, then this is the place to go, Dynamic. Here, this is very close to the Chinook train station, very easy to find. There are lots of parking, and so that's the first step actually for you to have a better life and to have a better relationship as well.
Yeah, because good sleep is good.
Yeah.
Right? Good sleep is good for you.
That's right.
Anyway, so that's awesome. That's amazing.
Roy, thanks for sharing your expertise, and thanks for having us in this beautiful, dynamic office, or shall we say clinic. Thanks for joining us tonight in our community perspective. To all who are watching, thanks for tuning in, and I hope to see you again.